Go for it.
Did you have the chance to see the program for September, Chris?
Yes, very nice.
About the course?
I love your topics on the second day. I love it.
Last time we did this course in 2 days, and we tried to put everything, the most important part in 1 day. And this time we will have some live demonstrations. Todd has some, and Giancarlo, they have some cases that we plan to do with the guide, the SFOT guide, the TED guide live. So I think it's going to be cool.
No, it's definitely the topics that I would love to learn.
And the course last year, Rick Rowley was connected and participating too. It was very cool, right, Todd?
Yeah, it was great. So great to have him on. And
every lecture he brainstormed a lot, so it's good to see both talking, Todd and Rowley talking about airway on the concepts. So,
Yeah, so I can see where we are now projecting live onto Facebook, and so we'll get started, guys. I appreciate you joining me from, I'm assuming you're both in Spain, right?
Yes.
Same
neighborhood.
Yeah, and it's the evening there, and midday lunchtime here in Texas. And we're really just having an informal discussion today, getting us all excited for September. We're going to be bringing Christian back for, I think, the fourth time for the new and updated DSD day, and then we'll follow that the next day with Danielle and myself doing our third version of Beyond Periortho Limits, which is kind of taking digital workflow into the interdisciplinary team for this airway-focused digital workflow to treat pretty much all types of cases. Obviously, a big component of orthodontics and surgically facilitated orthodontic therapy and even orthognathic surgery. So, wanted to get these two guys together and really just chat a little bit about what's new. You know, what's new in your worlds. How does that feed into the educational programs we're going to be conducting in Houston this year? And I'll start with you, Christian. Just, again, thanks for joining us, and tell me a little bit about what you've been up to and what's so exciting about this new course that we're going to be doing in September.
Todd, I always enjoy so much interacting with you and your team, and for for the last few years, Texas became a DSD hub. And of course, that is also due to the great work that you, Giancarlo, and everybody working on your teams are doing regarding the concepts that we are putting together. It's a beautiful teamwork of us here, trying to develop solutions, utilizing technologies, and you guys, with amazing clinical experience, giving us guidance about, what you guys need and how this collective intelligence can help us make better decisions for our patients. So I believe that we are on this constant evolution. We all know, always learning, always improving, like we always do in life in general. But I believe that for the last 3 years, there was a maturation of everything that we've been doing. Of course, we're going to continue to evolve, but we are in a very good position now where solutions are very realistic and bringing real value to all the clinicians and patients using it. So it became more pragmatic, it became more accessible, it became more simple to do the things that we are doing. And I think that's the goal of my part of this program. An amazing program. I was looking at the details today of the program that we are putting together, and this is the type of course that me as a dentist, I would love to do myself. On the first day, I'm going to try to cover more conceptually why we are doing what we are doing. I'm going to basically challenge people to think outside the box, to get out of their comfort zone, to rethink their career, their path, to exercise where they want to be in 5 years professionally, to understand how these new ideas can nurture even more your passion for what you do, nurture even more your pride for what you do, and allow you to reinvent a little bit your performance. Why it's so important for us today to be open to these new things, and more than that, what are the risks for a dentist? What are the risks for a business owner, a dental office owner, of not being open, at least to explore a little bit these new ideas? Are there any risks? What are these risks? And how can we increase the chances of success as a clinician and as a business owner in this very interesting decade ahead of us?
Yeah, awesome. And I guess what would you say to those folks that have joined us before and they're going to be coming back for another round of this? What do you think is the newest concepts it will be bringing to the table in September?
I think, of course, I'm biased because I'm talking about my own course, but I would say I wouldn't miss it. There's so much to be refreshed. There's so much to be re-strategized. There are so many strategies that are now so much more clear. And I think that, most of the people implementing these ideas were exposed to these ideas at least 2 or 3 times, at least. Even if you ask Giancarlo, how many times he saw this happening before he made the move, or before he realized the business model, or before he was able to onboard his team, or before he was able to have a clear vision and then inspired the people around him to make it happen. So we've been following up. I think this is the biggest difference, because now, and this was probably one of the few things that were positive about the pandemic, among all the bad things that pandemic brought, was the fact that was allowed us to deep dive into the impact of everything we do, and to analyze this impact on all the clinics that are using it. So we did a very profound auto-analysis, self-analysis of our ideas and how these ideas were impacting clinics, tracking the numbers, tracking the metrics, tracking business feedback, tracking clinical feedback, and polishing all the strategies. Is what I'm going to share on my day there is the conclusions. After a decade working on these concepts, after a decade of maturation of the technologies, but mainly after the last 2 years of serving smart dentists and learning from them and hearing them and analyzing the impact in their businesses and realizing what works, what doesn't work, what can work even better, and how can you, in a 12 months project, make this revolution happen for you.
Yeah, I think that the evolution we're all experiencing, it takes, even if you've had the best courses, it takes a long time to get your team's mind wrapped around it. They're not the dentists. They don't see it like we do. So we have to see it. Then we have to be able to communicate that to the team and get the team understanding that it's part of our workflow, and it's something that we can't go backwards, right? We can always have validation.
By the way, this first day, Todd, I would strongly suggest people to bring their right arm, to bring their treatment coordinator, to bring their main assistant, to bring their technician, to bring the key people, to bring your orthodontist, to bring your periodontist, if you're a GP or if you're a specialist, to bring your restorative dentist. it's a team vision. It's a team sport.
Yeah.
This dentistry that we are talking about is a team sport, and it starts with the team surrounding you. So really the staff. The treatment coordinator, the main assistant, the hygienist. The if you have an in-house lab, all these people, if they can come with you to this day, I can bet, that you will not regret.
Yeah, no, they're always. I mean, I can't wait to see it myself. Right, having seen many, it's just it's always inspiring and motivational to walk away from these courses, kind of reinvigorated to continue that journey. Daniel, thanks for coming on here. Listen, I think that I'd love to hear from your perspective. This concept of beyond perioral limits that we've worked on for a few years now, and now is actually in press for textbook coming out this summer. Kind of give the audience kind of your perspective on that and what it means to you as a clinician.
Yes, first of all, it's a privilege to be here with you discussing these topics. And it's also a privilege to us to work with these amazing clinics all over the world, as we are at DSD. And we can actually see everything that we start discussing few years ago, the solutions that we are creating on a daily basis with feedbacks from doctors from all continents, right? And they are working together with us to improve, to develop, guide solutions, protocols. And this is what Christian just mentioned, the collective intelligence. I don't know if you was the one who invented this term, Christian, collective intelligence, probably the one who represents better. And I think this is what we have been doing, right? Our collaboration thought. We met each other in a residence too in São Paulo at Well Clinic, and then we start discussing about orthodontics and SFOT and how to expand the limits of orthodontics. And nowadays, after 2 years now working inside DSD, I can see that when we want to pursue an ideal design, and when we're talking about ideal, we need to be clear, we're not talking about aesthetics only. We are talking about aesthetics, about area, about function, occlusion, TMJs. This is the ideal. Normally, we need to more than just ortho, right? And this is where perio enters with a lot of impact, with corticotomies, bone grafts, and MARPI, MSC, and everything we're going to discuss in the second day. I think this year, this course is going to be amazing because Christian can make this amazing introduction about all the concepts and how to understand where we want to go, right? What is the ideal? And in the second day, we're going to show all the high-end solutions, although some of them are simple, but it's very cool to see how they can improve the outcomes of ortho, right? And this is my expectation. As Christian mentioned, I like to see not only orthodontists there, because nowadays the GPs are doing more and more ortho, and they need to know these concepts. If some doctor hearing us today wants to go for the first day, be sure your ortho be there with you, at least for the second day, so they can later understand everything you're going to ask them. So the program, it's very cool. I'm very excited.
Yeah, I think the exciting thing for us now is to really have the solutions. We talked about them for the last couple of years, but now to be able to come into this course and really use the platform, the digital platform, collaboratively amongst the different disciplines to plan maxillary skeletal expansion, followed by some type of facilitated orthodontics if necessary. So surgically facilitated therapies to do aligner therapy, and then on the end, after taking advantage of the orthodontic collaboration, usually in these complex cases, there's then a need for prosthetics. So kind of taking, after completing tooth movement, redigitizing our patients, and then moving on with final restorations, whether it includes teeth or implants, is really been found to be a powerful workflow for us in allowing us to treat lots of patients differently than we did just a few years ago. So I think that's super exciting to be able to now put it into a course and share what we've been able to accomplish over the past couple of years with this digital platform.
Yeah,
I think that is important for people to understand that it's definitely not about fancy, sophisticated, new fancy, sophisticated clinical solutions. It's about really, in my understanding, by what I've been learning, it's changing the perspective of how we need to treat the patients, and it's changing the perspective of how far we can go with realistic procedures, how much more impactful and meaningful dentistry can be in the life of the patient by understanding, basically what we are talking here is that we are expanding our treatment planning guidelines from just purely facially driven into facially and airway driven. And this creates the revolution that forces us to understand new tools that we need to use to have an airway impact on our patients. So it's a beautiful thing to say, but if we don't learn how to incorporate these tools, we cannot make this life-changing deliverables happen. So I think all the tools that you guys will show, on the second day are exactly what we've been seeing as the minimum package that every smart, modern, restorative clinic, and I'm not talking about restorative dentists here, I'm talking about restorative clinics because that's the future. Dental clinics, not dental office, not a GP office, not a restorative office, not a perio office, not an ortho office. Interdisciplinary dental clinics where patients will go, and these clinics will be able to amplify their diagnosis, amplify their treatment planning, and create more comprehensive solutions to change the quality of living of these patients by not only understanding how to deliver a beautiful smile, but how to deliver better well-being. And that's where airway becomes the key central factor, in my humble opinion. The factor that will change dentistry in the next decade, by understanding how can we help people, put the pieces on the right place. And veneers is not the solution. Just opening the vertical dimension is not the solution. Just doing orthognathic is not the solution. These simple mandibular advancement devices is not the solution by itself. It's understanding the comprehensive approach and the tools that the modern periodontist needs to learn, the modern orthodontist needs to learn, and the modern restorative dentist needs to learn.
Yeah, I think that also talking a little bit about our collaboration going back, Danielle, with Octavio, and what the orthognathic surgeon brings to the table here too is that I'm not saying everybody wants it or needs it or will do it, but to have that ultimate ability to give them informed consent about what they truly need from TADS, and MARPI to SFOT to orthognathics, that is this concept of a powerful visual informed consent through the digital designing and sharing with the patient and mock-ups, and that really kind of changes the whole conversation between the dental team and the patients.
Yeah, and by using the digital, we can, even Octavio, amazing surgeon, he wants to avoid orthognathic. And by doing these simulations, by test driving before, by trying option 1, 2, or 3, we can understand and leave orthognathic as the last available option, right? And this is what we want, to try to be the less invasive possible with the best result possible. And more or less is what is the storytelling for the second day of the course, right? We want to discuss the limits of ortho, how much force can we apply and how to surpass by creating better bone remodeling. What are the boundaries of only ortho and how to expand by doing SFLT, corticotomies, by doing expansions with MST, and when it's unavoidable to do orthognathic, and when orthognathic is needed, how to be the most assertive, the most predictable possible, the less invasive possible, and doing this, being guided by the face, by the area. So this is the storytelling for the second day, and I think we are going to cover all of these topics.
Yeah. Christian, anything else that you want to share with the group here regarding changes and innovations coming that we don't know about yet with digital smile design?
No, I think it's much more about maturation and simplification. It's not about new fancy ideas, and it's about improving our leadership skills as well, to motivate the people around us to change with us. Because, as I said, we cannot do this alone.
Yeah.
So this is a challenge that we are seeing doctors facing. But how can I convince my lab to do this? But how can I convince my orthodontist to do this? But how can I convince my assistant to do this? So it all comes back to polishing your vision, creating an excited vision of this future that everybody can see how this can impact their own life, how to onboard people around you. So I think that the first day will be about, helping people to clarify the vision so they understand the exact story that they need to tell to onboard people around them.
Yeah. What are you feeling are the biggest impediments still? Is just the dentist committing to it, or what are you finding is the biggest impediment for those that maybe come and take and learn a little bit about this but don't follow through?
Yeah, I think that the number one challenge, that we see, I was able actually to organize 5 main challenges that I see are blocking doctors to, regardless of how excited they are, to implement these ideas. The first one is not having a clear vision. So we're going to try to exercise that. What is this vision of the ideal, modern, comprehensive smile rehabilitation clinic? Number 2 is to help people to prioritize so they can go step by step, because they feel overwhelmed with all these new possibilities. So hopefully during this day, we're going to help doctors prioritize what is the next step, what is the first step, what is most important, how can I start changing without going crazy, how can I start implementing without going crazy. Number 3 is lack of systems. Without systems, there's no results. And we feel like we are wasting time and energy. And this is a big problem for dentists because people didn't teach, we didn't learn how to build systems and implement systems in dental school on the broad meaning of systems. So we're going to share some insights about, before you invest on fancy technology, make sure that you have a very clear system implemented. What is your system? That's number 3. Number 4 is about the people. How can you understand which people you need around you and how to put the people on the right place, onboard the people, and make people become the best versions of themselves so you can have a dream team. That's number 4. And number 5 is to generate enough excitement that this excitement can be converted into energy, and this energy can be converted into discipline. Because only with discipline, we can make all these cool ideas become a routine. So these are the 5 main challenges that I see are holding back doctors and dentists to implement these ideas, even when they are super excited, when they hear the ideas. Why most of the people end up not implementing these ideas. These are the 5 bottlenecks, and hopefully during this day we're going to share strategies to overcome these 5 bottlenecks.
Awesome. Yeah, that's great. That's great. And then Danielle, from your perspective now, coming over to the planning center, been there less than a year, right? About a year. Oop, you moved there.
Here in presence for a year, completed actually yesterday, 1 year.
Yeah, excellent.
Time flies, right?
So as someone
that started working 1 year before from Brazil, connected online, right? And what I'm going to bring is, just last year we did almost 1,000 DSD Invisalign cases, right, with TPS. And those cases, almost all of them were interdisciplinary, where we need adjunct therapy. And I hear a lot from doctors that, I don't want to use that because I'm afraid I'm not used to it. So in an amazing effort from our team, and also with collaboration with some doctors, partners, we developed, for example, this DSD TED guide that we are going to discuss, right? Which doctors, they are using much more TEDs with a lot of accuracy. And we could, in this past year, validate a lot of protocols for aligners to prove predictability. And I'm going to bring the most important ones that we are using, that for sure doctors can, the day after the course, can put in practice and can start using in their clinics, right? We have a lot of things every day. We are there discussing new ideas, and I think a lot of cool things that are going to happen in the near future. But I'm very excited with what we have today. Maybe in September we have something new, I don't know. Everything is going so fast, and this is good that we are working with a lot of amazing doctors that can help us to give us the courage to do this, right?
Yeah. No, I mean, it's an exciting time. I mean, I've heard all of us say this many times. It's an awesome time to be a dentist, right? The technology that's available to us, and to treat our patients better, more predictably, sometimes faster. It's pretty awesome, and to be able to do it with a team approach, whether you're a solo dentist or you're a group of restorative dentists and specialists and lab technicians all working together. It's platforms like this that have allowed us to do it on our own, or do it with a group even better than we could do before. I've said it again and again. It's been an absolute game changer for us in Houston, for our patients and for our clinics. And it's these. How did we get started? Well, we took a course, right? We went and took a course and devoted that time and effort to learn, and then slowly integrate it back into our practices. So super excited about another go around here in September, and seeing you all, and hopefully a lot of people getting back to the idea of travel and coming to Houston for a good couple days of learning and then implementation of what can be a huge game changer for your practices. So Christian, final thoughts, words on anything?
No, I wanna thank you for the invitation, for the opportunity to come back to Houston, and I'm sure we're gonna have also fun. We're gonna have some great time together. Always great doctors coming together in these courses. So I'm super excited. Already traveling all over the world full power, at the same level as pre-pandemic already. And
it's good to hear.
Great, yeah, 100%, and great that Houston is on the map for me, and I'm going back. So very, very happy to see you guys soon.
Yeah. And Danielle, you too. You got to come pick up your vinyl.
Yeah, I have some ordered in your house, right? Last year I was supposed to be with you, and because of the pandemic, I need to connect online, but this year for sure I'm going to be there. I'm going to eat some Texan barbecue. I won't miss that, and it's an amazing opportunity to brainstorm and to have some drinks together and to meet each other and to learn more from each other, right? I remember the first course we made, and I believe some of the DSD clinics nowadays come from this course.
Right.
And that's people who went there believe in the concept, and now they're working together with us. So I'm pretty sure it's going to be amazing, a great opportunity for all of us.
Yeah, very much. And those that have joined us today, thanks for coming. We these courses are the registration is live on our website, the IHDS website, which is www.ihdsce.com. Got some other great courses coming up in the fall as well. One dedicated to max rate skeletal expansion and SFOT that Mariana Evans and I will give. So we've got a lot of great stuff coming this fall. And it's going to kick it off with Christian and the DSD team, and following day Danielle and myself with Beyond Para with Our Limits, September 23rd and 24th. So guys, thanks so much. Good to see you. We really look forward to an awesome course coming up in September.
See you guys. Bye-bye.
See you.
All right.
Thanks, Todd.
Bye-bye.
Bye-bye.
Take care.